All right, so it's a weakening question. Easy to tell that. And all right, so what would you call the conclusion here?
Since their patients will not be harmed, it might. Should always be allowed to prescribe them.
Yes. So you're saying advocates of these herbs as remedies for serious illness should always be allowed to prescribe them. Yeah.
Mhm.
Why? Because
They will not be harmed. It might be helped.
will not be harmed and might be helped. Yeah. And what are the other ones?
Few, it's safe to consume, and few dangerous side effects.
While a few have dangerous side effects. Okay. So few have dangerous side effects, some proven safe, and you cannot be harmed. But where is the leap in logic though? Because it says few of them have dangerous side effects, and then some of them have been proven to be safe. But then what does it say in the conclusion?
Should always,
Yeah.
for serious illnesses, because
Yeah. So I think when they say these herbs though, seems like they're referring to, what do you think they're referring to when they say these herbs?
the ones that are safe to consume.
I think so. Yeah. I agree. So I think because they're referring to the ones that are just safe to consume, it's a little bit of a better argument, right? At least it's not saying, you know, there's only some that are good for you or harmless, so you should be able to prescribe all of them. So I thought that was what it was saying at first, but this is better. So it's saying just the safe ones you should be allowed to prescribe. But what do you think about this? So it's not a horrible argument, right? Because it's saying you can not be harmed by them and you might be helped by them. So why not prescribe them? Because they can only have a benefit, right? However, do you think that's true?
I don't think so. Because there was what I was thinking, it was because there's a difference between safe to consume and harm. That's where my brain kept going.
What do you mean by that?
That they're different. Just because you're safe to consume doesn't mean you can be there could still be side effects to it. Or
no, I wouldn't say that. That's not what is the issue here. It's okay. You don't have to be able to guess it yourself. Let's just go through the choices. So it says, but the point is, just because you won't be harmed by them doesn't necessarily mean that you should always prescribe them. That's what you want to think about here. Okay. Because you're trying to weaken the argument. So you have to think here, you have to go under the assumption that just because you won't be harmed, it's not a good enough reason to just prescribe them willy-nilly, right? So A says, many practitioners and patients neglect more effective conventional medicines in favor of herbal remedies. So do you think that weakens the doctor's argument that you should always prescribe them?
No.
I would say not necessarily. I would probably leave that one though. I feel like there's some credence to it at least. It's not the worst answer choice. So I would leave that one. Take a look at the other ones. So many herbal remedies are marketed with claims of proven effectiveness when in fact their effectiveness is unproven. What do you think about that? Would that really weaken the argument?
No.
Yeah, I don't think so either. One thing I will tell you, so both of these say many. When you see many, and some, those words in weakening, often it's not the right answer. All right, it's a kind of a clue you can use. It's not always going to be 100%, but it's a pretty good indication that it's not going to be the right answer. What about C? Some patients may have allergic reactions to certain medicines that have been tolerated by other patients. Do you think that weakens it?
No, because it's not talking about the herb.
And yeah, I don't like that one. So what about D?
I would say no.
Vast majority of purveyors of alternatives are driven by as much by the profit motive. What do you think is the problem with D? What kind of fallacy is D actually?
Oh, it's just.
Do you remember what it was called?
Is it part of a whole? No, I just like that.
Do you remember ad hominem?
Yeah, that's ad hominem.
Yeah, why do you think I say that?
Because you're putting on the vast majority, so you're putting it on what they say.
You remember what ad hominem was?
You're attacking the person that's making the accusation or the claim.
Yeah. So why do you think I say that D is doing that?
Because if they're driven by profit, that's like seen as a bad thing, so you can't trust them.
Yes. So you're implying that the people are not trustworthy. Exactly. That's irrelevant. Whether they're driven by profit or not, that doesn't prove that they're going to do the wrong thing, right? Because every doctor is getting paid for what they do. So does that mean no doctor is to be trusted? Not really, right? Any pain relief or other benefits of many herbs have been proven to derive entirely from patients' belief in the remedy rather than from its biochemical properties. What do you think about that one?
I say that would benefit it, because then if they're obviously patients are benefiting from it, so that's eliminated.
Yeah, so I don't think that one is necessarily wrong, but it's a hard one. Yeah. So I guess it just leaves A. Why do you think A then is the only one that we're left with?
But more effective conventional. Because there's more effective, and then the argument's like saying they won't be harmed and might be helped, but there's more effective things out there, but they choose not to.
So isn't that a form of harm in itself? Because
Yeah.
you're going with the inferior option rather than the best option.
Yeah. That's why, because like every time I saw A, I was like, no, and then I was stuck.
Because that's the thing, right? Something may not harm you, but it might keep you from doing something that's better for you. Because in a sense, watching TV all day isn't directly harmful to you. It's not going to hurt you. Like, it's not going to give you a disorder or give you physical pain or anything like that. But if that's all you do and you don't do anything else, not doing the other stuff might harm you, right?
Mm-hmm.
So it's kind of the same thing here. If you're just taking herbal medicine, not taking real medicine, you might run into issues because, this happens actually all the time. Where there was a big legal case. It was in the news a long time ago now about some parents that gave their kids herbal medicine. Their kid with like cancer or something, and they refused to get doctor's treatment, and they just gave them herbal remedies and stuff, and then the kid died, I think. And so the parents were prosecuted for that, for neglect or for avoiding or for ignoring doctors' recommendations. So yeah, that is what could happen to the extreme level, right? If you take that to the extreme. But yeah, so obviously there's nothing wrong with giving the herbal medicines on top of the regular medicine, because unless it interferes with each other, it should be fine. But if you then avoid conventional medicine in favor of herbal remedies, then you might run into issues, because they're not going to help. Even though they're not going to harm, they're also not going to help cure whatever disease you have, right? So yeah, I don't know if we talked about this last time, but it is about applying these situations to the real world and playing them out and seeing what would happen. So if people would do this, as they're saying, right, always be allowed to prescribe herbal remedies. If you think about what would happen if A was true, that people would neglect the conventional medicines in favor of herbal, kind of, if you play that out in your head, you can kind of realize, wait, if people just take all these herbal stuff for everything instead of the proper medication, then they might end up dying to some of these things. If you have lupus, it's not going to get solved by herbal remedies,
Right.
Your headache might, but not something that's actually dangerous or life-threatening.